Jim Daniels, why don't you go ahead and introduce our speaker for this evening?
I'd like to introduce Jennifer Waldo. She's a town nurse. I've had several discussions since she started her job when he started about diabetes, but we have other higher priorities now. So I'd asked her to come talk to us briefly about what's happening with the town with COVID-19. And then what we can do is open it up to questions. So I'd like to right now introduce Jennifer Waldo, please.
Yes, good evening. So I just wanted to be here and answer questions that y'all might have about COVID-19 and some of the activity occurring in Windsor. We continue to see an increasing positivity rate with a number of people who are testing positive. We do quite a bit of contact tracing, reaching out to those who are positive and speaking with them about their close contacts, those household members, other work members that might need to be placed in quarantine. So we spend a good amount of time with our staff in all sorts of those activities. Obviously, we're doing quite a bit of work also on reinforcing mitigation strategies, things, i.e. face masks. We talk about social distancing. 6 feet is great, more is better. And we talk about good hygiene practices with, hand washing and cleaning frequently touched items and surfaces. And I'm sure you've all heard quite a bit about that. So, I thought that it would be most helpful to answer questions in terms of the CDC and DPH guidance that I'm sure you've heard about, and just be available for those types of questions.
All right, do people have questions for Jennifer?
Hi, Jennifer.
Hi.
Hi there, I'm Cindy Daniels, and yes, I have some questions, and they center around the vaccine and how the vaccine is going to be given out. And I want to know, do you play in it? Well, I'll just say it all and then you can answer what you can. I want to know if you'll play an integral part in that, if it'll be done on the town level. And I've never heard any discussion about where teachers fall into the hierarchy of being vaccinated, and I'd like to know about that too.
Okay, so yes, we have been actively part of the planning for the COVID vaccine. We are currently awaiting for what's called EUA, the emergency use authorization. We've been talking regionally, locally about those plans in terms of, the state will have some say, as does, the CDC, and how it's distributed. What is tier 1? And there's tier 1A, tier 1B. It'll start with hospitals in terms of healthcare providers, and then as well as long-term care facility staff and residents. There'll also be a priority for first responders. And, the expectation is that as soon as the EUA is signed, we will be ready to start vaccinating. In terms of teachers, I think there's some talk that they're going to be kind of in that tier 1B, so kind of a second round, and we'll see exactly how others fall into place in terms of the availability of the vaccine as we move into the spring and to the summer.
Yeah, thank you.
And yes, the local health department will be playing a role. Our role is more focused on this initial wave of vaccinating first responders. We believe that once it is more available to the public, we will see folks going to their primary care providers as well as to pharmacies like Walgreens, CVS, et cetera.
Thank you very much.
Did I miss any part of your question?
No, you did great, thanks.
Okay.
I think Randy was next, actually.
Jennifer, with the increasing positivity rate that's going on in the state, is the town manager considering closing the town hall again to the public?
We've not talked specifically about that. I'm sure I report to him daily where we are in our numbers. And I think, each Thursday is when the new data gets presented by the governor in terms of individual town positivity rates. So we'll see kind of what happens. We're probably just beginning to see the impact that social gatherings had over Thanksgiving, because we're right about at that 14-day mark.
Thank you.
Jennifer, I think there are different vaccines that are going to be available. At least some of them require very cold temperatures for the entire handling process. I guess I'm concerned if facilities that plan to distribute them, such as even doctor's offices, whether they are fitted with the equipment necessary to keep the vaccine at the required temperature.
Yeah, I can hear you.
Right. We expect the ultra cold vaccine to be stored at hospitals who have the ability to do the ultra cold, as well as those universities or colleges who have research facilities. So they can be refrigerated at a standard temperature for a period of time. They'll all come with explicit directions. So the ones that we will get at the local health department will be able to store in our typical refrigerated process.
I have a question, Jen. If we're at high risk and our doctor knows, should we deal with our, get in the queue with our primary care physician, seeing he understands our risk? Or should we do that through the town?
I believe you would do that through your primary care provider. We, have been, again, focused on the first responders. So at this point, I don't know that the health department will be doing any kind of public vaccinating.
Okay, thank you.
But it certainly, if we do, you will see that information out on the website.
Thank you.
I got a question. How long is the vaccine supposed to be effective for? Is it a permanent, or is it like the flu shot and we redo it? And then part two of that is, of the two vaccines that are being released, is one last longer in its effectiveness or the other?
Those are all good questions, and we don't have all the science behind that yet. Okay. Think of the vaccine trials, we haven't been able to test far out enough. It might have been 3 months that we've had the trials. So at this point, 3 months. And we do know that people who've been sick with COVID have a 3-month immunity. We believe that the science is, it's been a 90 days, and anyone who has symptoms after that 90 days is considered a second case.
So they are being reinfected with the virus?
Yes. Not many, but a few. And so in terms of even comparing the two vaccines, we don't know yet if one will be more effective than the other. We also, as the science has shown, we don't know for sure that I guess, let me back up. The vaccine will protect us from getting COVID. We don't know that it will prevent us from transmitting the disease.
Wow.
Yeah, so that's another important question.
Okay. So there could be a second wave of vaccinations coming after 90 days? Start all over again?
I hope it's not 90 days. We do, we are thinking it could be much like influenza, where it will require an annual vaccine, but we don't know yet. And that's going to take us some time to do the research to determine the effectiveness or the long-term effectiveness of this vaccine.
Thank you.
Let's assume that, 80% of the population will agree to get vaccinated, but what is the timeline currently on when everyone who agrees to get vaccinated would likely get vaccinated, going down through the, I don't know how many levels, you said 1A, 1B, I don't know how many levels there are, but then I don't know if they're going to do it with school children. But what is the timeline for everyone to be vaccinated who wants to be?
Well, the thought is that by spring, we will have COVID vaccine clinics open to the public, but I'm sure it will be well into the summer months, if not into the fall months, before everyone has had an opportunity. We expect that folks will still be wearing masks or facial coverings. Just because you get a COVID vaccine doesn't mean that you'll stop needing a facial covering to protect others and others to protect you. So we consider that to go well into 2021. And we haven't There haven't been many children. I'm not sure that we've had any children in the vaccine trials. So how quickly they would be given the vaccine is unclear at this time.
Well, it's my understanding that statistically over many studies for the general population, the fatality rate for those who have been infected, not cases in the hospital, but for those who have been infected, is only like 0.2%. Whereas the fatality rate for those who are 70 or older of infected is around 4%. So it's multiple times what the average is for the whole population. Are there still going to be focused efforts towards the seniors and the ones who are most vulnerable, given that not everyone is similarly affected? Again, the overall rate infected who die is at 0.2%, whereas for seniors over 70, it's 4%.
Yes, I think that is a part of the priority planning in terms of who's going to have first access to the vaccine.
But in terms of other restrictions and the like, aside from the vaccine, and I mean in terms of restrictions that have been in place so far, in terms of closures, in terms of other things like that, are those still going to be extended long-term, as far as you know?
I think that, part of this has been complicated and complex in that this pandemic is new. And, Matt Carter, who's one of the state epidemiologists, has often said, we're building the plane while we're flying it. So information is ever changing. Science is, being researched and shared. And so as we move along, we get new information. So in terms of how long things might be closed or how long we'll be in this staged reopening is unclear.
Thank you.
Other questions?
I don't have a question, but I'd like to comment.
Okay.
Jennifer, this is Carol Engelman. I was one
Hi,
of your
Carol.
first COVID calls. And I just want to thank you very much because you were absolutely wonderful, very professional, knowledgeable, helpful. You gave me a great sense of peace that I was going to be okay.
Thank you, and you're welcome.
Jennifer, your wildest dreams, did you ever figure you'd be in this situation when you went to nursing school? Did you ever cover any of this, even slightly, or?
I had a unique experience. I did my undergrad work at Purdue University, and we did some rural healthcare. And so in terms of public health. And so that was my public health experience. I don't think any of us ever dreamed that we'd be in the midst of a pandemic. And so, being able to be responsive and adapt quickly to ever-changing information. And I think, Jim's point of it, how long is this going on? We don't know. And so every step along the way, as we make changes and see the impact, determines kind of those next steps.
Because they had an American experience about the Spanish flu, and it was the same thing. Every time they thought they had an answer for it, they had to rebuild the plane to change it a little bit, or whatever at the time. They had to rebuild the tractor to change it to keep going because things you thought weren't there and things that you thought were going to work didn't work. So it's kind of the same thing. But has technology helped with this situation a lot?
Certainly in terms of the record keeping, we have databases. And so a point to make is that all of the testing that Connecticut is doing, all of those lab results go into a database, and all of the positive results are sent out to each resident's health department or district. And that's how we have access to know who's tested positive and who we need to call. And that is kind of the initial part of the contact tracing.
That's a big job. Thank you very much for doing what you're doing, Jennifer.
Well, thanks. I guess the other point to share too is the new COVID information that was and has been in the news that the CDC released. So typically, if you are positive for COVID, you're placed in a 10-day isolation. If you are exposed to someone who's been positive, you are asked to quarantine for 14 days. And so there's been some newer science and some discussion about compliance with 14 days, because that can be a long time.
It can be.
And shortening that quarantine to 7 days if you have a if you have a negative test on day 5, 6, or 7, or shortening quarantine to 10 days without a test. So yes, the 14-day is the safest of those 3 options, but there is discussion about a 7-day with a negative test, as well as a 10-day without a test. Now, while the CDC has presented that and added that, the state of Connecticut has not yet adopted that as their clinical practice.
Wow, thank you.
Other questions?
I do. What can the Lions do to help you in the health department? I don't want to expose myself, but when this is over, what can we do to help you in the health department as Lions? Because we have a lot of boots on the ground. We could do something. I don't know what it is, but public information or just whatever this is over, what can we do to help you guys?
We'll have to give that some thought. I think, right now being the role models and trying to, do the mitigation we all can do.
Right.
And, the social distancing, the facial coverings, et cetera.
Right. Thank you. Be nice if we could get some Lions masks to show that off, but thank you very much. Thank you very much, Jennifer. I really appreciate this. I know you've been busy, but thank you for sharing this. We had 3 people in our club who have contacted COVID, 1 succumbed to it. Bloomfield Lions, 2 people have had it. You can't give their names out, so it is affecting our pride. It's not something we're isolated from, but thank you very much for the information.
Yeah, it's difficult. And we've seen some who have very mild symptoms. There are folks who are asymptomatic to those who are more critically ill and have passed.
Because we had a friend who lost a sense of smell and she worked at a nursing home and she went home, she got treated for it and her sense of smell came back and she was fine. So it's all different levels and it's a personal friend of ours who used to be a Lion. So it's out there. People don't think it's out there. It's out there.
Oh, it's out there.
It's really out there. I mean, it's effective. But thank you very much, Jennifer. I appreciate it.
Well, thank you for having me.
And this will be recorded and Jenny will put this on Win TV if you don't mind. It'd be good for people to have this information.
Okay.
Okay, thank you very much.
Thank you very much, Jennifer.
Thank you, Jennifer.
You're welcome.
Thanks a lot.
Be well.
You too.
Yeah.